Thank you all for joining us this evening. I know we all have busy lives, so I appreciate you coming out and making the time for this. My name is Jack, and I work at the Brattleboro Development Credit Corporation. I am the workforce education specialist, and you are all here to learn about healthcare careers. So if you are indeed looking to learn more about that, you are in the right place. Just a couple housekeeping items before we get started. This is being recorded. So if you are uncomfortable with that, you certainly do not have to participate or turn your camera on, and although we encourage you to do so. And if you are watching this as a recording, you can certainly contact me if you have any questions. My email and other ways to contact me will be at the end of the presentation. All right, and if you are here watching this live, my colleague Jen, who will introduce herself in a moment, is here to answer any questions you may have. You can throw them in the chat, you can raise your hand, or you can just unmute at the end, and we can talk about things. So, all right, without further ado, let's talk about healthcare careers. All right. So, thank you for joining us. Again, my name is Jack Spanierman. I'm the Workforce Education Specialist here at the Brattleboro Development Credit Corporation. We're excited to share more about this upcoming class that we have starting next month in October. And before we get started, I wanted to offer a little bit of information about us. So my colleague Jen will take over and talk a little bit about who we are.
A really little bit, 10 seconds. I'm Director of Programs at BDCC, and Jack and Ashton are part of our workforce team. We're a nonprofit that's based in Brattleboro. We've been serving Southeastern Vermont for 70 years. We've do a lot of different things, including helping companies build factories, and we have commercial real estate. But we also do workforce programs. So we have a full-time person who's in the schools doing career education, and we do programs for adults, including new Americans and just any adults. So funding for this work comes from grants, and our goal is just really to help employers find great people. There's a real need for workers, especially workers that have a certain set of skills, people who have certain credentials, like in healthcare. And we want people to find great jobs so that they, can earn enough to really thrive and live well. So your success is our success, and we're here to try to work on building career pathways. And we also know it's not obvious, because a lot of times the training that you need isn't being offered right away, and the funding isn't obvious. So that's a lot of what this class is about. It's just trying to piece together stuff that, is not obvious. It's not all intuitive or easy, but there are solutions. We want to connect you to them. Thank you.
Great. Thank you, Jen. All right. So moving on. So what are our goals for this class? Very simply put, this class is meant to expose you to all the various career pathways in healthcare, and we will work with you to help identify what is the best pathway for you. So what fits with you, your interests, and just where you are in your career journey. And you're going to walk away, and it's our hope that you'll walk away with a connection with the person that will be able to actually make that next step and make that career goal a reality. So we really want you to be walking away with something. And so the next question you may be having is, why healthcare? So there are a lot of great sectors out there. Why are we focusing on healthcare? Well, simply put, there is a demand for it in our region. This is a map of healthcare jobs in our Tri-County region. So as you can see, the darker blue is the higher concentrations of healthcare jobs. And there's a lot of them, simply put. And there's a higher concentration, of course, in the Keene area with the Dartmouth network, the Brattleboro area with the BMH network, and then just south of us in Franklin County, there's the Bay State network, the hospital network. So another key thing to point out here is the healthcare sector is predicted to grow. So we have an aging workforce. A lot of folks are retiring out of their careers. So this is a great time to get involved in healthcare and get your foot in the door. And this is just a map of hospitals in our region. And that's just one kind, as we will talk about in a little bit, that's just one kind of healthcare facility you might find yourself in. So the map to the left is just north of us, and you can see all the different hospitals, excuse me. And then the map to the right is just south of us. and this is really kind of getting into the nuts and bolts here of the data. So to back up what I've been talking about, there are over 8,500 jobs in healthcare in our Tri-County region. So that's a big number. But the figure I actually wanted to turn your attention to on this slide is on the figure on the far right. So the retiring soon. So I mentioned this. Um, we're above average in terms of workforce retiring soon in the healthcare sector. So it's definitely a great opportunity to get your foot in the door. All right, so next up we have a video that I would like to show all of you. It's just a brief video. It's actually a local filmmaker. Oops, I went too far. A local filmmaker, and this really gets at all the different, the story of jobs in Vermont. So let's take a watch.
One of the biggest myths that I hear around Vermont is that there are no opportunities. That's why people leave. That's why young people decide not to stay in Vermont. But when we look at the data today, that's certainly not the case. There are 2 open jobs for every 1 job seeker. Over the past year, there's been about 20,000 open jobs each month in Vermont, and the number of people seeking jobs, it's hovered between 7,000 to 10,000. So even if everyone who was looking for a job found a job, we'd still have upwards of 10,000 open jobs in Vermont. 70% of the jobs in Vermont don't require a 4-year degree. In Vermont, there are 50-plus jobs that pay higher than the state median and are in high demand, with over 500 openings over the next decade. So there are plenty of opportunities to go around.
All right, great. Okay, so next up, this is a graphic that we will return to quite a bit in class. And it provides an overview of the various career pathways within healthcare. And again, I want to call your attention to the green arrow at the top, towards the left side there. These are entry-level positions that you could potentially begin tomorrow with little to no training. And these are the types of jobs that we will focus on in class. And some you may recognize and others you may not. And again, one of our goals is to really expose you to all the various different kinds of healthcare jobs. And to explain a little bit more about pathways, we have another short video.
We often talk about the outcomes post-high school, the people that go to college and the people that don't, as one point where the populations branch out. But then we have to follow that pathway a little bit farther. Research shows that about 48% of high school graduates are attending college, so the other 52% are either joining the workforce or finding other pathways. But then we have to follow that percent that go to college. Data suggests that potentially 40% of them will not finish college. But there are many pathways to occupations that are higher paying and in high demand that include apprenticeships and trade school, certificate programs or other professional certifications. And there are pathways even within occupations themselves where you can do training on the job. That may be your first job in a step towards building a career. So the 4-year college pathway is just one of many options available.
All right, well put. That's one of our dear friends, Kevin Chu at Vermont Futures Project. All right. So now that we talked a little bit about what to expect kind of and why we're doing this, I wanted to give you a brief overview of the type of healthcare roles that we will be going over in this class. Again, some may be familiar and others might not be. And that's really our goal, is to expose you to all of them. So you can see on the screen, those are just the different kinds of categories. And I'm going to go through them very briefly now. It's going to be a lot, but we have time at the end. We can talk more about it. So Public safety, of course, these are firefighters, EMTs, paramedics. We're all familiar with these. Again, a lot of these roles may actually require a little bit of training and schooling, but certainly a great pathway if you're interested in emergency medicine. And this is another great pathway. So if you want to be involved in healthcare but aren't quite sure you want to have a clinical role and actually directly interact with patients, there's plenty of administrative roles. So you could become, you could work in the medical billing and records or human resource assistant realm, patient registration, the list goes on. So there are plenty of roles for you, even if you don't actually like interacting with patients. And similarly, if patients aren't your thing, but you do like science, there's a whole swath of technician positions. So lab tech, phlebotomy, if you like science, you like maybe blood, you may have to interact with patients a little bit there, but certainly less than, a doctor or a nurse. So definitely a pathway for you. And similarly, mental health. So mental health, certainly, we haven't mentioned it yet, but it's certainly healthcare, and we actually have plenty of roles available in our community. The Brattleboro Retreat is actually our largest employer, and they're state-of-the-art mental health institution. So there are certainly positions in that realm if you are interested in that. And this is a key point I want to actually touch upon here. And these are other jobs in healthcare settings. So even if none of the jobs or types of jobs we already talked about interest you at all, but you do want to get your foot in the door in a healthcare setting, there are other jobs available that you could potentially get elsewhere, but you may, hopefully after learning about things in this class, you learn that healthcare is a great environment to be in and get your foot in the door, as I keep saying. And there are plenty of roles, in the hospital and at the retreat. The list goes on for environmental services, activities assistance, etc. So great opportunity there. And lastly, I want to just touch upon the category you're probably most familiar. So direct patient care. These are LNAs, these are PCAs, medical assistants, and we actually have one more video to show you. And we're going to spend a lot of time in class talking about these roles, but I just want to have, there's a great, one of the last video that we'll show, but a great pathway video about the nurse pathway. So let's check that out.
I love the night shift. I have been doing it for about 13 and a half years, I want to say. I'm an RN night shift charge nurse at Woodridge Nursing Home. My mom worked night shift, which is kind of what showed me that that was an option, but oh my God, I'm so glad, because as my mom would say, I have never been a morning person. Anytime she tried to wake me up before 8 a.m., did not go well. Total monster. And I think I'm still that way. I think my husband and my kids would probably agree if we asked them, but we don't have to do that. And I just have always been a night person. I can stay up all night. It doesn't really bother me. I can nap anytime. I love coffee. So all those things together equal night shift. I do geriatric nursing, so we deal with the older population and people that, can't necessarily take care of themselves. And I just really like to be able to take care of people that need the extra help. I started my career in healthcare as a LNA, that's a licensed nursing assistant, and I did that for about 8 years before I got the opportunity to do a pathway program at work, which was bringing LNAs into the LPN role, so you could be a licensed practical nurse. And your schooling was provided by Central Vermont Medical Center. They assisted with payments and they helped you to work out a schedule so that you could actually work and go to school. And then I went directly into the RN, or registered nurse program. It was a couple of years of schooling. You can definitely go a more traditional route, like right out of high school, and go into an RN program at a lot of colleges. But that just wasn't really in the cards for me. I had, kids kind of at a younger age. And even at that age, I didn't know what I wanted to do, where I wanted to go. There was that stereotype that if you didn't go to college, your career path was maybe looked down upon, or, people were like, well, you're not going to be able to make any money if you don't go to college. Everybody wants to see this degree. Whereas that really, it doesn't matter. you know, we can break that stereotype because there are plenty of careers now that you can get that on the job training, or even if you do need that degree, you can get that through your place of employment. I mean, they offer classes that you can take, or like mine, where we had this pathway program. There is never going to be a time, if you are a nurse, that you do not have options for a job or to go anywhere you want in your career. My husband and I really felt like we were successful when we were able to buy a house. You know, we own our own vehicles that we can pay for or lease, because I love to lease a good vehicle. And the fact that if we want to take off and go on vacation, yes, it is tough sometimes to get the time off of work between the two of us and our jobs. But if we want to, we can. We don't feel like we are just stuck in this day-to-day, I don't want to say 9 to 5, because obviously we all know I don't do that, but we're not stuck in this rut of just working and going home and working and going home and never having any fun. We ended up in Vermont a little over 12 years ago, and we just haven't looked back. We love the atmosphere here, the community feeling. When we came to Vermont, it seemed like we fit. We found where we were meant to be.
All right. I think that video does a great job just illustrating the flexibility that that healthcare can provide to a person looking for a great job. Okay. So now that we kind of provided a little bit more about the content, we're going to switch gears a little bit and talk about logistics and details. So in this class, you will be connected with employers, you'll be connected with training providers, and you will be connected with financial opportunities and different pathways, again, of funding. So, and that some of those key entities will be VSAC, and I don't know if you're familiar. The list is there on the right, and so certainly we'll talk plenty more about that. And then another key piece of information is all classes will be held at the brand new Southern Vermont Workforce Center of Excellence, which is our brand new, as I said, workforce space downtown. It's on 8 Flat Street. And there is an attendance expectation for this class. So there will be 4 classes. I'll mention that in a second. I'll talk more about it. But there's a financial incentive. So we have a $250 stipend if you do complete all 4 classes. And these 4 classes, of course, they will be beginning in October, and they will be wrapping up in early November. And each class will be 3 hours. And the four classes will be broken into 2 kind of pieces. The first being field trips, so those job site visits, and 2 will be actually in the classroom doing classroom work. And another key piece I wanted to mention is that you are going to be supported by us. So available to students is career coaching and referrals to those various entities that really will help you get to that next step. And we want you to succeed. So our goal is really to make sure you find that career path that works best for you, and we're here to help you do it with all these things on the screen here that you see. Okay, so that was a lot of information. So let me slow down, take a second, and recap. I just presented a lot of information. Healthcare is a highly in-demand industry. There's going to be a lot of openings in the coming future, and it's a great time to get your foot in the door. You will learn about the various career pathways that are in front of you and available trainings and ways to pay for that as well. There will be 4 class sessions that you will be expected to attend. And of course, lastly, we're here to help. We are here to support you. We want you to succeed. And we just wanted to share some quick anecdotes about what that success looks like. And I don't know if Jen, would you like to share about this?
Yeah, we ran kind of a longer, slower version of this class this summer for folks for whom English is not their first language, and people were coming from all different walks of life, people who already had experience in medical jobs and people who had no experience in medical jobs. And really, we take the same approach with everybody, which is to figure out like where you are and then give you a lot of information about what the options are in the area. Not like, if you live in another part of the country, but like here, like what are the jobs that are available here? And then what are the training pathways to sort of get into those jobs? And then we just help you figure out like, what's it going to look like long term to get there? And what is your absolute next step? Like, what is the next thing? And so of the people we worked with in that class, 4 of them are just basically now they're continuing with their regular jobs. They work in factories or cafeterias or a bank, but they're working on a class. They're taking like an online class with help from Vermont Adult Learning and the Tech Center. And it's just to get them familiar with medical terminology so that they feel comfortable because they want to have a healthcare career, but they want to learn some of the words and the concepts before they try to step into a harder class. One person transitioned from a job at a nursing home that they were already doing, like a kind of a PCA kind of type job, and then got their LNA. But now they're in the hospital at BMH because now they're able to access some training programs that they have internally at the hospital that weren't available at their previous jobs. So they're going to be able to advance there. Another person is working in healthcare and started as a PCA and has been working, but has really figured out, we spent a lot of time on sort of what's the long-term goals, that they want to take the LPN, that's the licensed practical nursing pathway. And that's going to require, for someone who's got a lot of responsibilities and a family, figuring out a whole bunch of things. So they're spending this year getting all of those logistics in place. Those are just some examples, but they have a clear plan. And by the fall, next fall, they're going to enter. And right now they're figuring out, kids getting settled in school and, getting transportation figured out so that, fall of 2025, they like kick off that LPN class. So some examples, it really, we have another person who worked in a factory and is just now entering a PCA job. And, this is their very beginning of being in healthcare, and they hope to become a nurse someday as well. So doesn't matter where you are, doesn't matter what you choose to do. We have somebody who got interested in dentistry. They don't want to, that's what they want to do. So we're working on that. They want to be a dental, assistant and hygienist. So we don't have an opinion about what you want to do, but if we can expose you to what the options are, and if anything seems like it's a real fit for what you want to do, we want to get you started.
Well said, Jen. Thank you. Great. So next, I just have the flyer for this class up on the screen here, so you can take a look at it. It has a little bit more details on the dates and times of the class sessions. And if you want this, I can get it to you. If you're watching this recording, certainly feel free to reach out. For those of you on the call right now, let me know. I can send you a copy of this electronically. I can print it out and get it to you. We can meet and we can talk about it, whatever you'd like, whatever you need. I am available to do that. All right, and so drum roll, please. If you are interested in registering, this is how you do it. So you have 2 options. And I realize it says 1 or 1, so that was a mistake. There are 2 options. So you can contact me. You can contact Jack Spanderman, that's me. There's my email there, or my office phone there as well. Or you can scan this code. So if you have a cell phone handy, you can scan that code and you can fill out our inquiry form, and there'll be more information there. Again, you'll connect with me. So you have some options. All right. So at this point, I think we're going to turn it over to questions. And if you don't have any, that's okay, but we're here to answer anything.